This is Mitchel Zoler from Global Medical News Network. I'm at the annual meeting of the European Congress of Rheumatology in Copenhagen. I'm speaking with Dr. Laurie Tucker, who's a pediatric rheumatologist at BC Children's Hospital in Vancouver. And Dr. Tucker was just speaking at a session about SLE in children and how it develops in children and might differ from adult-onset SLE. And Dr. Tucker, you were talking about some data that you published last year looking at the juvenile-onset cases. Those cases were affected by renal and neurologic complications, especially compared to the adults?
Yeah, that's correct. And this is an interesting population. These are all adult patients in the study, and we compared a group of patients who had onset of their disease between ages 13 and 17 years to a group of patients who had onset of their disease between 19 and 48 years. And what we found, and the mean follow-up was about 4 years, was that if you looked at the damage in different organ systems, that the juvenile onset patients clearly had more damage in certain systems, the renal, neuropsychiatric systems particularly, and a higher rate of end-stage renal disease. And you could easily say that this is obviously important because these are major organs. It indicates a need for more aggressive treatment to prevent long-term damage in those systems.
And what would be some of the specifics of that aggressive treatment that you might apply?
Well, I think most pediatric rheumatology centers would treat children who have renal and neuropsychiatric disease with high-dose corticosteroids and immunosuppressive agents, whether that is cyclophosphamide, azathioprine, or mycophenolate. But these would be applied early in the time in the disease activity.
Mm-hmm, mm-hmm. And that usually seems to have a positive impact on these patients?
Well, most patients respond to these courses of treatment, but I think the difficulty is that if you're 14 when you get your lupus, you have a lot longer to go with your lupus than if you're 40 when you get lupus.
Right.
And lupus is a disease that flares. We know that at least the majority of our patients are going to continue getting flares into adulthood, and so the concern is that they are accumulating damage at a rapid rate, and this can impact their ability to function later on.
And so would also an additional message be that if you have an adult who you know has had childhood onset lupus, to particularly be on the lookout for these kinds of complications?
Yes, I think these patients require more careful scrutiny and more careful follow-up over a long period of time.
This is Mitchel Zoler from Global Medical News Network.